Can I give an update on COVID today? We've got 9,630 new cases. 3,419 of those are rapid antigen test registration. So again, thank you to Queenslanders for continuing to register when they take a test and get a positive result at home. It's really important you make sure you're getting that information into our register as well. We did 22,437 tests in the last 24 hours. Sadly, I can report a high number of deaths again, 16 deaths reported in the last 24 hours. That brings us to 218 deaths since the 13th of December. The age range in the main are between their 50s and 90s, but sadly I can report one under the age of 10. And I'll have Dr. Gerard speak to that one shortly. But it is sad to see those deaths, and certainly of a young person. 7 of those deaths occurred in aged care residents, and that puts us at 114 deaths in aged care residents to date. We have currently 764 patients in our public hospitals, 49 in ICU, 26 non-ventilated and 23 ventilated. So this is seeing the numbers come down a bit again, and 74 patients reported in the private hospitals with only 1 in ICU and none ventilated, which is good news as well. So we're seeing those numbers come down slowly, but what I want to say is that we will continue to ensure that our hospitals are prepared and planning. I have visited Logan Hospital yesterday, Redcliffe Hospital last week, as well as the Gold Coast, and the new triage portable buildings are being installed both at Redcliffe and Logan as well. We know that these new buildings are really helping to help with triaging of COVID patients, but also the flow off our ambulance services. And we're seeing real benefits from our supervisors, our paramedic supervisors who are working on the ground at our ramps, at our EDs, and also working with these new triage bays, that they've seen a significant decrease in lost time, which is fantastic. So I know they'll be welcome at these new other hospitals as well. Our vaccination rate is 92.03%, so great to see our first doses over 92%, now an 89.63% double dose. So we're slowly creeping towards that 90% double dose. Again, I remind people, if you are due for your second dose, you can come forward and get it at any one of our clinics. You can also go to a pharmacy or GP. If you are someone who had COVID recently and you were due for your second dose, when your symptoms have gone and you are healthy again, you can come forward and get your second jab. And of course, our boosters, please keep coming forward and getting boosted. We're at 56.6% boosters, and over 1.448 million cumulative boosters have been administered so far in Queensland. I am concerned about the 5 to 11 and the 12 to 15-year-old age group. We're at 35% 5 to 11-year-olds first dose, which is over 167,571 doses. But that rate of 35% has certainly been slowing down in the last week. School is going back next week. We really do encourage parents to come forward with their young ones and get them vaccinated. And again, our 12 to 15-year-old, our doses at 75.5 first dose and 67.54% double dose. This is too low. These kids are going to be going back to schools, the teenagers are going back to school. There is no reason whatsoever, considering that our adult population is 92% first dose, there is no reason why your children's vaccination rates shouldn't be at the same rate. There is so much opportunity to walk in, to book in, to go to a pharmacy, to go to a GP or go to a public vaccination clinic. There is absolutely no reason to wait. If you've got a booking in the future at a public clinic, there is walk-ins available right now. You can bring that forward, you can walk in today, they'll cancel your future booking, it's okay. You don't have to wait for that booking for that first dose, you can walk in. And I really encourage people to do that. I also just want to talk briefly about, I saw the comments from the Commonwealth Government, the Morrison Government and Greg Hunt yesterday about aged care, about the allegations of shifting blame. Now, everyone knows that the Commonwealth is responsible for the regulation of residential aged care. They are responsible for the funding of residential aged care. And, as Scott Morrison has said numerous times, they took responsibility for rolling out the vaccination program across residential aged care at the start of 2021. They were also to take responsibility for the disability sector and also work collaboratively with our Aboriginal and Torres Strait Islander health services to roll out the vaccination in our remote communities. The concerns I'm hearing in aged care are the same concerns I'm hearing from stakeholders in the Aboriginal and Torres Strait Islander health sector and also disability sector about the Commonwealth and supplying PPE and support for rapid antigen tests. It is up to the Commonwealth to report the data of how many aged care residents have received their booster versus the total population of aged care. We don't have that data. That data is not being publicly reported, and it should, because if we're going to be responsible for the rollout of vaccinations, every state, territory and Commonwealth should report their data. And it is the Commonwealth's responsibility. They are the ones who have organised for these vaccinations to be delivered to these facilities, to not just talk about the percentage of facilities visited, but the actual number of people who have received the booster. We report it on every other age group and category, but it's not being publicly reported on aged care. So if there's any blame shifting going on here, it is the Commonwealth, it is Scott Morrison and Greg Hunt when it comes to aged care. And it is my responsibility as the State Health Minister to raise these concerns because stakeholders are raising it with me. And it would be irresponsible for me to remain silent on those concerns and the concerns about how many people are dying who have not received a booster as aged care residents. We want to see that data. I'll now hand over to Dr Gerard, and then we'll also hear from the Acting QAS Commissioner and also Hayley and Lachlan, who are our new recruits with QAS, who are happy to speak to the media and take any questions as well. Just leave that there.
Thank you very much, Minister. So sadly, it is my duty to report there have been 16 deaths in the last 24 hours reported to us. This includes the death of a child under the age of 10. This child had a very serious underlying rare inherited medical condition, but even so, this is very, very sad for the parents of this child. We also have reported 2 people in their 50s, 5 in their 70s, 3 in their 80s, and 5 in their 90s who have died. Among these, 6 were still not vaccinated, 6 of the 16. 2 had only received 1 dose, 5 had received 2 doses. Only 2 had received boosters, and we don't have information on 1 of those 16. So still that booster rate, particularly in such a large vulnerable group, is just really not adequate at this stage of the pandemic. We really should be seeing a much higher booster rate, and that is disappointing. 7 of the people who we're reporting as dying today were aged care residents, and we've reported 114 deaths in aged care in Queensland to date. So again, it will be a very, very sad time for the families of all of these people. In terms of the hospital system, there are again some improvements, that's good to see. We have 763 people in hospital or public hospitals being treated for COVID-19. That's down significantly from yesterday when that number was 801. So that's a significant decline. A slight decline in intensive care admissions from 50 to 49 in that last 24-hour reporting period. In our private hospitals, we have 74 patients being reported to us with COVID. That's up a little bit up from 67 yesterday. And if I could just reiterate what the Minister said a little while ago, with schools returning next week, we really want more both primary school children aged 5 to 11 and adolescents going back to high school to get vaccinated before those school starts, because we know that the virus will spread around the schools. That's inevitable, and the more that are vaccinated, the better. So I'll now hand back to the... Yes, sir.
I know there's probably little you can say about that case, it's most likely before the coroner. Can you touch on whether they were their immunity system was compromised, or that was the underlying issue?
They had very serious underlying medical problems and a rare inherited disorder.
And the slowdown in the vaccination rates for the 5 and older, what do you put that down to? Do you think parents are just wanting to drive this down?
Well, we certainly hope not. I don't know. It has been a very substantial decline. There was a great rush to pick up the vaccine early on, and it has slowed down just in the last few days. So I hope that is not the case. I hope the parents have not become complacent. As I've said before, it's very hard to get the tone right. I don't want parents to be frightened, but if I had a child going back to school, I'd want them to be vaccinated, at least have that first dose on board before they started.
I guess it took almost a year to get to nearly 90% of the population over 16 vaccinated. Was it ever realistic to expect that any more than, say, 30% of children would be vaccinated fully by the time they were headed to school, or even have one dose?
Well, the vaccine is available. There are lots of spots there, and they're not being taken up. So, I think it's certainly realistic to have more vaccinated by now. It's a little disappointing, but there's still chance. There's still time. It's Monday's a few days away. The Queensland Health clinics will be open over the weekend, so there's still time to get that first dose in. So please come forward and get vaccinated.
And what kind of protection does a first dose for a child provide? I mean, maybe a lot of parents are thinking, well, there's no way to get them fully vaccinated, so we'll just take our chances.
Number of things. First, there's no doubt that one dose will give some protection against the virus. Secondly, the virus is going to be around for months, if not years. So even if a child is not exposed in this wave, then over the next few weeks or months, it's almost inevitable that a child will be exposed to this virus. So we may as well all get vaccinated. Even if you haven't been vaccinated yet, there's still plenty of time. We think probably in this wave, probably by the end of February, about a third of Queenslanders will have been infected. That still leaves 2/3 of us who will be infected sometime in the coming months. So it's not too late to get vaccinated.
We might just hear from the Acting Commissioner and Hayley and Lachlan. We'll come back to questions.
Thank you and good morning. And firstly, thank you and good morning. And firstly, can I just thank the Minister for Ambulance Service, Health and Ambulance Services for coming along today, along with the Chief Health Officer, and not only welcoming this group of new paramedics that are starting with us this week, but also acknowledging the work that they have done over the several months and during this global pandemic. So this is a really exciting opportunity for these 60 people to join our team. This is a career they've been training for several years now, and they get an opportunity now to join the Queensland Ambulance Service. They started their induction earlier this week. They are with us for 4 weeks now. They will do some training here and onboarding here. They'll do some emergency driver training before they hit their regions between Cairns and Coolangatta and the Darling Downs and most places in between. So they'll be back on the road towards the end of this month, and we're really looking forward to that group hitting the ground. This group, as the Minister's already said, is part of an ongoing recruitment program that we've had since the start of COVID, or in general terms. What we are trying to do is continue to manage the demand, the normal demand, the annual demand that we see, and put a level of surge workforce out into the community to help with not only the COVID demand, but to replenish our workforce. They're not immune to the disease either, obviously, so replenish that workforce and keep the doors open and ensure that we can get the care that's required to the community in as fast as possible way as we possibly can. So as an emergency service, we're quite well versed in, peaking and troughing and responding to surges in demand. We've done that. We have well-planned arrangements in place for that, and we pride ourselves on our ability to coordinate resources across this state of Queensland. So can I also just congratulate myself personally, congratulate the graduates here today for everything that they've done and what they will no doubt deliver for the community of Queensland over the coming months and hopefully years for their longevity of their career. While I'm here, can I just mention the heat, please? people know the last 2 days, ambulance services really respond in periods of heat. The last 2 days have seen very high demand for ambulance services. It's really important that people remain hydrated, stay cool wherever they can, staying air conditioning. We're aware that people, particularly our vulnerable, are staying home at the moment, the elderly. If you've got a loved one or a dear friend, please check in on them. Please make sure that they are well hydrated and cool. And if you need 000 in an emergency, please call us and of course we will respond. Thank you very much.
You said that it's a surge workforce. What happens to them once the surge is over?
So, as the minister's already said, we are bringing on a large number of paramedics that will remain in our workforce in permanent capacity. This group of people will remain on our employment in various flexible work arrangements until such times as they are absorbed into the system. There is a pathway for people that come into the system in this way to get permanent employment as we build over the coming years. That's correct, yes.
Acting Commissioner, can I ask, it's been the first time you've spoken publicly since there were some reports about your annual leave, about the union's unhappiness. Moving forward in the role that you're in, how is your relationship with the union and can you respond to those claims about your length of annual leave?
Yeah, well, I've been back at work for a few weeks now, and I must say that during that period of my leave, I remained in contact with the workforce. It was we were embedding, plans that we've had in place for 2 years, and we've got a very strong and depth in our executive, so they delivered on that. But as I said, I was in constant contact with them each and every day. As far as the unions go, we do enjoy a good relationship with the representative union, and I'd hope that would continue into the future. See no reason why not.
On face value, do you think it was a good look to be on annual leave during that peak that we were in? Just on face value, do you think it was a good time to be on annual leave?
I think for people who realised, everyone knew that I was at work, albeit maybe not in the office, but heavily engaged in the ongoing planning for COVID and the delivery of that. And in my time back, we have, as I said, we've managed through this first peak. We're starting to see a dip. Our workload tends to follow the general norms of community caseload and what's in the hospitals, and we're starting to manage that quite nicely now.
You might just hear from Hayley and Lachlan, and then we'll take questions.
So pretty short and sweet. I think I can talk on behalf of our group of newly graduates that we feel extremely privileged to be given this opportunity to work in such a high demand at the moment and serve our community.
How does it, just quickly, how's it been? I mean, obviously different now considering we're in this COVID world. It's been different for you training-wise, and what have you learned out of that considering what we're actually going through?
The training that we're provided is very in-depth. Obviously we have to go over PPE and COVID patients and all that kind of education as well, but I think we are very well supported in this pandemic.
How long have you studied for?
So I did a double degree, nursing and paramedicine, which was 4 years.
And you're one of the permanent?
No, I'm casual, yeah. I'm fortunate to work as a nurse as well at the same time.
And we might hear from Lachlan.
Thank you.
Thank you. Good morning, everyone. My name is Lachlan. I'm a graduate paramedic in Metro South. I just want to take this time to thank Queensland Ambulance for giving us this opportunity to be in this induction and to be a graduate paramedic. For a lot of us, we've worked very hard and it has paid off. So we want to thank you for that. We all know the evolving community with COVID and that it's very diverse out there, and we're very excited as all of us grads to go and be a part of that and be among the community and do what we've done best. Yeah.
So what's been, I guess, the driving force behind your decision to be a paramedic?
Yeah, definitely. So I used to be a surf lifesaver, and around that environment, there's lots of paramedics and lots of very inspirational people. And from then on, I figured, I'd love to do this as a career. Studied for 3 years and finally got the opportunity. Fantastic, thank you.
Minister, what I was going to put to Dr. Gerard earlier is this rate is low, and I know we've touched on this before, but what about moving forward? We go to school, class 1B, if you haven't had your shot come in, school nurses there, one after the other. Is that an option moving forward?
Look, it's certainly an option going forward to build in, future boosters, vaccination. We don't know what the future of vaccinations are for COVID at this stage, whether there'll be annual boosters or what's going to happen. But certainly the ability to build that into our normal school immunisation program is there. That is the most sensible pathway going forward. As far as this period though, because that immunisation program generally is spread over the whole year. So there was some schools as late as November still getting their immunisation programs, visiting those schools. We didn't want to take 12 months or wait 12 months. And the question before about, well, it took 12 months to vaccinate, the 16 plus. Well, that's not completely correct, because many of those people were not eligible till at least June. We started with aged care, we started with the frontline workers, and gradually we brought on different age groups until we got to the point that 16 plus were eligible. So it was really only about 4 or 5 months that all of those people, 16 plus, were able to go get vaccinated. It was an incredible achievement. But to say that, I actually think we can be doing far better with our vaccinations for 5 to 15-year-olds. Our child immunisation rate is around 95% in Queensland. If you're willing to immunise your child for all of the other diseases that we know are important to keep your child safe, then you should be willing to bring your child forward for one of these vaccinations. That's the most sensible thing, and to do that sooner than later. We've got around 65 schools this week and this coming weekend that are online, in addition to our normal vaccination clinics and GPs and pharmacies that can vaccinate children. So take advantage of that. Look up our list of schools, there's lots of them, and go out and get your child vaccinated in the next few days.
There were some supply issues, even when you opened up to children. We had people who were saying that they, showed up for their appointments and they were told they didn't have any vaccinations there. Are supply issues still a problem, and is that playing a factor as well?
So those issues and people's bookings being cancelled, as I understand, were around community pharmacies and GPs who hadn't received their supply that they had ordered at that point. But I'm pleased to say, as far as I know, that supply chain is now happening, that community pharmacies have the vaccine, that GPs have vaccine. We certainly have plenty of vaccine, the paediatric vaccine, for children and for the 12 to 15-year-olds. Plus boosters, we have plenty of vaccine at all of our clinics. So there's no reason people should be concerned about supply.
Minister, on rats, what about, obviously schools are going to require a fair few. We haven't touched on it for a few days. Where are we at with the schools?
Yeah, so we got another supply this week, which is great. It is hit and miss. We were expecting 1.1 million to deliver a week and a half ago, and then we got told mid to late last week. We were supposed to get 300,000 last week, and we got 33,000 instead. But we did get our supply, as I understand, what we were expecting this week, which is good. We will keep looking at other channels of getting supply wherever we can to ensure we've got the volume that we need. But we do have supply there at the moment, and Queensland Health have assured me that we'll be able to meet that demand in our schools as well. I've seen the reports around Minister de Brenny today, but can I say that the former archivist put out a statement on Facebook yesterday afternoon actually stating that there was no allegations against the minister or his office. That statement was put out there. So, well, to ask the minister or to suggest the minister should stand aside when the archivists themselves have clarified the record and said there is no allegation from the former archivist against the minister or his office. If there is something that's occurred within the department, there are channels to make those complaints and those allegations, and they should be investigated. But to level that against the minister when the person who has talked about this issue has clearly stated there was no allegation, then that should be taken on face value and respected, that the archivist, and I acknowledge that he has done that, and that is the appropriate thing to correct the record overnight.
I didn't know.
I haven't interfered with any reports. I can't talk for any other minister. I can't talk for anyone, but that's not, that is not the practice. The HHSs produce their reports, the department produces the reports, and as the minister I table those reports. And I'm answerable to those reports every estimate. So.
Would you agree that it would be unacceptable for that?
If there's errors that have been identified or anything like that, then it's reasonable to identify any errors and ask for clarification on those. But as far as asking for it to be changed, no, there shouldn't be interference with annual reports.
David Christopherly has asked for Parliament to resume early as the Leader of the House, obviously this will probably come across your desk. Would you entertain an idea like that so this can be discussed?
No, Parliament goes back in a couple of weeks. The opposition will have plenty of opportunity to ask all the questions that they want.
Do you think your government has an issue with integrity?
No, I don't. I'm very proud to be part of the Palaszczuk government that from day one, we outlined our desire for full transparency and integrity as a government. And we have shown time and time again through the processes, through the legislation that we have introduced, that we do that. We are the only one in the country, the only state in the country that has put criminal laws and a criminal offence around register of interest and conflict of interest for ministers. And no other government has done that. We have one of the lowest reporting obligations around political donations, remembering that the Morrison government, and if the LNP was still in at Queensland level, you would be able to make a donation of over $14,000 and not record it, not say who it went to and who the donation was made from. That is extraordinary that that can still occur in this country. There are many, many changes we have made to strengthen the CCC, and where issues have arisen, and this is good government, where issues have arisen, they have been investigated, they have been referred, and they have been independently reported on. And that is what you expect of a government. There will always be, from time to time, issues that arise. It's how that government responds to it. And the Palaszczuk government has responded by making sure that when these issues arise, they are investigated, they are reviewed, and the relevant bodies who have the authority to exercise those powers to make reports, to investigate and to make recommendations have done so.
But in this case, is the investigation into the claims about Minister de Brenny, about the laptops?
Well, the allegations against Minister de Brenny have been clarified overnight by the archivist.
What about with Nicholas Stepanov and Mike Summerall?
And all of those matters have been absolutely canvassed by the Premier as far as what's been referred to the CCC and what is being investigated and what she has asked her Director General to look into. Again, the Premier has on these occasions made sure that if there is an allegation to be investigated or reviewed, it is done and it's referred to the relevant bodies, and it is then in their hands. And we have always said public servants should operate without fear or favour to come forward if they've got any allegations whatsoever. And I know as the former Attorney General, I dealt with a lot of referrals to the Crime and Corruption Commission that no one was ever aware of, because we just got on with our job. It wasn't a political stunt. We just did what we had to do. I did what I had to do. And it was about making sure we hold up the integrity of the government and the public service as well. I just know when I was in opposition, the fear of the public service. That is something I will never forget. The public servants who were intimidated, I saw it for myself. The ones who were practically in tears saying, if they find out I'm talking to you as an elected member of Parliament, I will lose my job. They were terrified. So I'm not going to be preached at by the opposition. And we stand on our record, and the opposition can stand on their record as to what legislation they've opposed when it's come before Parliament, and can explain why they took that approach. Rachel Hunter is a highly respected and experienced Director General, and I have absolute confidence and faith in her ability to investigate anything that is being referred to her.
I was asked about Greg Hunt's yesterday. He says that there is an arrangement between the federal and the state government to access stockpiles of things like PPE, which you have criticised the Commonwealth for approaching you about.
Yep.
Is that arrangement in place, and were you trying to muddy the waters, I suppose?
Not at all. He should read the whole transcript or watch the footage from yesterday. What I said is the Commonwealth does eventually reimburse the states and territories for that. And I've seen other health ministers saying, well, you said that we were going to get that reimbursement last week. It didn't come. So, it's not like we get reimbursed the next day. My issue is this. There is a national medical stockpile. We know that they want this and need this PPE. Why is it that they need to make these urgent requests for us to supply it and then eventually reimburse us? We have stepped in and helped residential aged care for years. We always have this partnership. I remember during the vaccine rollout, we were providing GPs with actual syringes and PPE because the Commonwealth hadn't got the stuff to them to start vaccination yet. We were sharing that. We've always done that. I have no problem with that. But what I have a problem with is that stakeholders keep saying to us that they're asking for this from the Commonwealth and it's just not coming when it should be coming. And yes, we can step in to help, but the Commonwealth should be doing their job. It's not like COVID just crept up on us overnight. For 2 years, we're going into the third year of managing this. Yeah, and it is for the Commonwealth to actually be supporting aged care, disability, and doing more in our remote Indigenous communities to support them and working with all of our amazing Aboriginal and Torres Strait Islander health organisations, the community-controlled health organisations, Quake, IUE, all those amazing organisations, providing them more support to get the vaccination rate up and also to get the PPE that they need in the mats. Thank you.